Welcome back. Concerns have been raised about obesity on South African children and 65% of women being classified as overweight. These findings were put in the spotlight during World Obesity Day on Monday. Now, for more on this worrying conversation, we're now joined by Nutrition Wellness Dietitians Director, Naidoo. Mr. Naidoo, thank you so much for joining us on Newzroom Afrika this evening. Very, very worrying. How did we get here?
It's a very good evening to you and your viewers, and thanks to Newzroom for creating this platform for advocacy. I think if we ask how we get here, it's that the key thing is urbanization and westernization of our society. And by that I mean we've cut down on our activity levels due to the modes of transport we use, due to the lifestyles and the work schedules we have. We're opting for more fast foods, that's more processed, more salt, more fat, more sugar. And we sort of lost our way in terms of healthy eating. And in time to come, both with kids and with adults, we're seeing that the burden of disease is growing more and more.
And also just looking at commerce as well and looking at the kinds of restaurants that are popping up, fast food restaurants, drive-thrus, of course, even more apps that you can access on your tablet or your cell phone, quickly getting you that right kind of comfort and junk food, or should I say wrong kind of comfort and junk food. There's it's almost culture of convenience, and these kinds of modes of being able to get food are quite convenient, and people are inundated, they are busy.
Yeah, no, absolutely. And, you know, there's this old Chinese proverb that I once read in a coffee shop, and it sort of stuck with me for a long time. And it went along the lines of, he who doesn't make time for healthy eating must later on in life make time for illness. So, you know, it's something so short, but it was quite profound to me, reminding us that, you know, unless we are very mindful of what we fuel our body with, essentially in time to come, our burden of disease is going to be very high.
That's a very noteworthy quote to actually take as well. But also when we look at the pricing of healthy foods, of looking at organic products as well, they don't come cheap.
Yeah, no, absolutely. I think there is a misconception that healthy eating is quite expensive. I must agree that there are ways to eat healthy and cost a lot. But, you know, as dietitians, we work with individuals and with patients to create solutions of what they have in their cupboards. I worked or trained in the government sector, and the big thing there was incorporating into patients' lifestyles. Can they create their own vegetable gardens? Can we think of more reasonably priced protein sources? So those things would be beans, peas, and lentils, which is high in protein, low in fat. So there's always ways that we can get an individual to eat healthier, lose weight, but it requires a very structured approach. You know, a Google search on something is going to give you an abundance of good information, but it can be a bit confusing and a bit noisy to the individual. So we always suggest connecting to a dietitian to start that journey with you.
How do we get to a point where women are sitting at 68% being classified as obese and men only at 31%? What are women not doing right?
So I think it's based on genetics as well. It's also based on medications that women are sometimes on, which has a side effect of weight gain. It's courses of steroids, tablets that could also worsen the weight gain. But also we're seeing a very low prevalence or low amount of moms opting to breastfeed. And we know that breastfeeding is something that burns a lot of calories, especially after childbirth. So when we look at it, it can be linked back to those that are opting not to breastfeed struggle to lose that weight after childbirth. But, you know, essentially, those are just some of the factors. But the core of it is this urbanization. It's the westernized diet that we've adopted, very low in fiber, very unnatural, high processed foods, and lots of sugars, you know, things just to keep us going from meal to meal.
Now, experts have said that driving this inequality, driving the surge of obesity as well is inequality. And you spoke earlier that, you know, it's not always about it being expensive to be able to have a healthy diet. But when we're looking at this, to say that inequality also plays a major role, if you're advising your clients and your patients to say, look what's in your cupboard. What if what's in the cupboard are all the wrong things as well?
Absolutely. And, I think we've got to be cognizant of it. Any healthcare provider who's not cognizant of a patient's budget loses that patient in that consult very easily. You can see the patient becoming disengaged. You see them seeming to have that body language that they want to leave the consult. So it's very important for us to be conscious of budget. But there's something I discuss on many interviews, on many platforms, and it's a simplistic plate model which we utilize. And if one can abide to that, you can definitely help yourself to eat healthier and lose weight. Half of your plate should be vegetables. So that could be any vegetables, and a reminder that potato does not form part of vegetables. Madumbi does not form part of vegetables. Those are more of your starches. So half of the plate, veg or salad. A quarter of your plate would be your protein. So that could be chicken, fish. If you're having red meat occasionally, that could also be your beans, peas, and lentils. And then the other quarter of your plate is your starch. So that's your bread, rice, pasta, putu. Very often what we find in our communities is that the portion of carbohydrates that we're having is far too large. That then increases insulin levels in the body, and that thereby starts the cycle of this inflammatory response and obesity in the body.
Is it also perhaps, Mr. Naidoo, and you can correct me here, this is your speciality, that, those proteins that you speak of and the starches that you speak of that do constitute a lot of people's diet is what is affordable, is what they were able to get, that maize meal?
Absolutely, absolutely. So it's about trying to think about portion sizes. If you could still have the putu, the maize meal, that's perfectly fine. But what we're saying is, as opposed to having chicken with the skin on for that meal, opting to have beans, peas, or lentils in that. If you're having a meat-based curry, whether that's beef or lamb, trying to add some lentils, some beans. In that way, you're increasing the fiber, but you're also having leaner cuts of protein in it.
And also, they're less expensive than actually going and buying meat.
Absolutely. So there is this complete ability where if you come to a dietitian, I could plan everything under the sun that's going to cost you a fortune. But then I've really missed the boat if I haven't connected with the patient one-on-one to understand where they are, not only in terms of budget, in terms of their medication dosages, their blood values, their medical history, their food preferences. That's where dietitians come in to make an individualized plan for the individual.
And also, children have not been spared. Earlier, you were talking about lifestyle as well, and that, more and more people are going for the convenient option. There's less exercising, there's less playing. Children have tablets to keep them entertained as opposed to playing in the streets now. Now, that's also had an effect on children's diet as well. For parents who are worried about this as well, how can they change this for their children?
So just to quote the stats before I get into that, if we're looking at kids between 6 and 14 years old, it's about 13% of them are either overweight or obese. Kids under 5, it's the same sort of percentage, 13%. And the studies tell us that if a child is obese, they have a 5 times higher likelihood of becoming an obese adult versus a child that's non-obese. So telling us that what we do in these early foundational phases of their life is going to set them up for a whole trajectory of either having diseases or not having diseases. And these diseases we talk about are diabetes, hypertension, heart disease, sleep apnea, and various other. To answer your question specifically, it's about trying to get the child back to a more natural diet, trying to incorporate a lot more vegetable, but also try to think about how much of activity is this child doing. If the child is eating in front of a tablet or television, they're not going to be in tune to when to tell you they're full or when they have reached satiety. So what ends up happening is they often overeat. If they're not very active, they're not burning enough calories. And often when we have takeouts, they're very calorie-laden, which means at the end of the day, the body says, ooh, I've got extra calories. What I'm going to do with it, I'm going to store it by converting it to fat. So essentially for parents, it's about trying to get your kid involved in healthy eating. What we find is that if we get the child involved in meal preparations, get them to have decisions on what vegetables they like, get them involved in terms of what portions would be actually appropriate for them, that tends to have a better outcome in terms of obesity.
And are there ways that we can make vegetables and healthy eating more attractive for children as well? I mean, I just look around with the children I see around me. To get them to eat vegetables is almost impossible. And this is an old adage that kids just go yucky when they see vegetables on their plates. Are there ways we can maneuver around this? Because I'm trying to think of a parent who is used to getting takeouts for their children and then suddenly switching to a vegetable diet and the meltdown that may happen in that household.
I think you've got to subtly, introduce it without, shocking the child's system, because psychologically and also from a taste perspective, you can imagine a child that has a high sensitivity or is very inclined to have a lot of sweets, chocolates, and cakes. When you give them a bland vegetable, it doesn't appeal to their taste bud. For that child who's had an early introduction of lots of high sugar items, they're more likely to attract to salt items later on when they're looking at meals. So salty chips and all of the unhealthy items that increase one's calorie intake. So to answer your question, I think it's important that you try to make it subtle. So often what parents do is they hide it in another meal. So if the child likes a pasta, they may add a bit of butternut, a bit of other vegetables into that so that they can still sort of have their favorite meal with a little bit of a twist. But, again, the message is there's an abundance of dietitians, good dietitians, both in the private sector as well as in the public sector. So connect to one and let them walk that journey with you. You don't have to figure it out all on your own, and you need somebody to monitor your bloods, you need somebody to monitor your body composition, and this is the role we play.
It's really good to know you don't have to walk that journey alone, because it is quite a treacherous one. Thank you so much for your insights and joining us on Newzroom Afrika this evening.